What's up, everybody? It's Dr. Palvia again from Physiologic in NYC. Today I want to talk to you about a subject that I don't really talk about much in my profession, at least not right up front. It's the S word that I want to talk about, and not the S word that you're thinking about, but the other S word, which is surgery. I get a lot of questions about surgery, and I just kind of want to weigh in on my thoughts there. Surgery oftentimes, especially in a conservative thought process, gets a bad rap. I just want to talk about what are the reasons that surgery should be considered. Now, first and foremost, I do believe that surgery shouldn't be a first option almost always. And the reason for that is, while surgical techniques are super advanced now, surgeries are very routine. As y'all know, I'm an anesthesiologist. I provide anesthesia for surgeries, dozens of surgeries per week. I don't think surgery is necessarily dangerous per se, but that being said, it is invasive, and so that therefore it shouldn't be the first option, generally speaking. So what are the reasons you should consider surgery, especially in an orthopedic setting? In orthopedics, orthopedics is your connective tissues, your skeleton, these sorts of things. So reasons that you may need to consider surgery right off the bat are the following. If you have some kind of traumatic injury, first and foremost, which basically causes a trauma that is so severe that conservative measures cannot address it, then the surgical conversation is going to happen early. For example, if you have an injury where you break a bone, some bones can be repaired by conservative measures, maybe just immobilizing, putting on a cast, things like that. But if the break is severe, or if there's an actual destructive process with the bone, or if the bone is displaced, meaning that even if you do leave it conservatively or treat it conservatively, it's not going to heal properly, that's going to be a big problem. And so therefore, I do believe displaced fractures or displaced breaks are important to be addressed by a surgeon. First and foremost, any kinds of breaks. Other things are, for example, if you rupture a tendon where you have a clean break, a tendon basically is a rope that attaches, a rope-like structure that attaches a muscle to a bone. If that rope breaks, there is no amount of conservative therapy, whether it's physical therapy or if it's stem cell regenerative therapy, that's going to connect those two pieces together. So in those cases, I would recommend a surgical consultation, generally speaking. The other two categories that I think of when I want to discuss surgery are if there's also some neurological problems. So for example, I get approached a lot about, I'll see a patient and they'll tell me, oh, we'll talk about, let's say, an ongoing back problem. We do an MRI result. We pull up the MRI on the screen, we go over it together, and then the patient basically tells me, oh my God, doc, do I need surgery? And I always tell the patients, that depends. The MRI doesn't determine surgery. It's your symptoms that determine if you're gonna have surgery or not. So if you're having some kind of neurological issue, for example, if you have a pinched nerve in your back and that nerve is basically compressed and irritated and inflamed to the point where now you're developing neurological issues, for example, numbness or weakness, or even things like loss of balance or loss of motor control, or even loss of control of your bowel or your bladder. Now you're talking about a surgical situation that because this neurological problem may not be reversed by conservative management. So then it's also important to have that surgical discussion, at least to understand what's involved. The situation may improve without surgery, but it's important to consider that option. And then the third situation where I recommend surgery is if you are having pain. And this is one that's a little bit more subjective, but it's important. At the end of the day, I'm an interventional pain physician. I'm treating your pain. We use several conservative measures. If you come and see me, usually we lay out a plan. We try to come up with a plan that will lay out a pathway for improvement. But if you're continuing to have pain on a daily basis that's disruptive to your lifestyle, then it becomes a quality of life issue. And sometimes then conservative management, including physical therapy, rehabilitation, chiropractic care, medical management, interventional treatments, if those are not sufficient, then we also will have that surgical conversation, because at the end of the day, it's a quality of life issue. These are the three things that I think, three areas where I consider surgery. Generally speaking, there are others, but those are the big three. So, make sure when you have that discussion, don't be so afraid to discuss surgery. You want to know what all your options are before you proceed down a path. So that's it for this one, guys. I hope you found it informative. If you did, please share it with your friends. Feel free to ask me any questions, drop me a comment below. I'll see you in the next one. Thanks.